The waist-to-hip ratio. Our expert pharmacist, Dr. Kathy, explains that the waist-to-hip ratio is an incredibly effective way of evaluating metabolic health as well as empowering patients on their health journey. When analyzing body composition, measuring the waist-to-hip ratio is second only to the in-body, which can also be found at select Hometown Pharmacies. Most people have gone through the body mass index, or BMI form of measurement, in terms of assessing health and body fat. The issue with this tactic is that it does not take muscle mass or visceral fat into consideration as the in-body machine does. That being said, even those with an excellent BMI score, which is between 18.5 and 24.9, could have little to no muscle mass, which could result in an exceptionally poor health span. However, when using the waist-to-hip ratio, muscle mass and visceral fat is accounted for. Let's talk about how you measure your waist-to-hip ratio. To begin, the waist is defined as halfway from the bottom of your last rib to the top of your hip. Some rely on the navel, or belly button, as where the hip begins. This is not advised as it tends to shift, especially after a couple of babies. Now to measure. Be sure you have an 120-inch body tape measure. Then, take the tape measure to the bottom of your last rib to your hip bone. In inches, write down your first measurement. Next, the hip measurement starts at the hip bone and reaches around the widest part of your buttock. This would be considered to be the round of your buttock. Do not pull tight. Record your measurement. With your measurements, divide the first measurement from around your waist by the second measurement from around your hips. After you've calculated your results, use them to compare where you stand on the chart I'm about to show you. The World Health Organization classifies health risk with the following information. A low health risk for men is less than 0.95 and for women is less than 0.8. A moderate health risk for men is from 0.96 to 1, and a moderate health risk for women is from 0.81 to 0.85. And a high health risk for men is greater than 1, and then for women is greater than 0.86. In cases, research of the waist-to-hip ratio has found increased belly fat, inflammation, increased blood pressure, blood glucose, insulin, and lipids. This further proves that the waist-to-hip ratio is beneficially used as an early intervention for your health before glucose and blood pressure rise, and other problems show up as well. For those who have a higher waist-to-hip ratio, further education, diet, activity, stress management, and food and cooking knowledge are advised. To get further information on how to help lower your waist-to-hip ratio, please stop into your local Hometown Pharmacy, where you can discuss options with your pharmacist, who will be happy to help in any and every way they can. Now that you have a better idea of the waist-to-hip measurement of health, please go on over and watch our other detailed videos explaining the other 4 metrics of health.